As part of my practice, I see women in their 20s, frankly, even in their teenage years, not at all infrequently. And the chief complaint, the thing they come to see me about, is a lump in the breast. Now, I don't want to be smug about this in any way, but literally I can almost sit in my office, and if a woman in her 20s, let's say a 22-year-old as an example, has a lump in the breast, probably greater than 97% of the time, that lump is a fibroadenoma, a benign ball of tissue that can get a little bit bigger, get smaller, stay the same size. And the indication for me as a breast surgeon to take it out is particularly if it's getting bigger. Now, can breast cancer occur in women in their 20s? You bet. Is it common? Not common at all, particularly somebody under age 25. In my own personal experience of 27 years now, my youngest patient was actually 23 years of age. Now, this is out of several thousand patients that I've taken care of over these years. So, and then when you look at the literature, the incidence of breast cancer in women, particularly in their earlier 20s, is extraordinarily low. What about trauma? Can trauma cause a lump in the breast? Women are playing soccer, women are playing softball, women are riding skateboards, women are falling. So trauma to the breast can certainly cause bleeding into the breast, which can cause a ball of blood, and that ball of blood is called a hematoma. And it may be perceived then as an actual physical lump in the breast. So if you're in your 20s and a lump has been discovered in your breast, clearly you need to be evaluated. Almost all of us will not, I want to repeat, will not get mammograms as our initial evaluation. What we will do, though, is a physical examination, obviously find out about your family history, and then ultrasound is really the key way of evaluating lumps in young women, lumps in any woman, frankly. And then, depending on the ultrasound results, perhaps a needle biopsy may also be necessary to confirm what the ultrasound is suggesting. So if you've got a lump in your breast, you're in your 20s, it's distinct. Often the fibroadenoma feels like a little marble rolling around under the skin. Please have it evaluated. Have it evaluated competently. Make sure that ultrasound is done, and if indicated, of course, a needle biopsy. Hi, I'm Dr. Jay Harness, and I want to share with you important information that I believe that every newly diagnosed patient with breast cancer needs to know.
I'm a breast cancer survivor.
I am a breast cancer survivor.
I am a breast cancer survivor.
And I want every woman to know
About personalized breast cancer treatment
and the genomic test.
A test that helps guide a woman and her doctor
to the best treatment options for her.
Pass it on.